Hello friends, my name is Kaushal and I'm going to talk about a topic which is dedicated to all diabetic patients who work in Dr. Kiran's Diabetes Care and Research Institute. So the topic is Covid-19 and diabetes. American Diabetes Association's Covid-19 page report which gives tips specific to people with diabetes. Outbreaks of novel viruses should always be a public health concern, but not a reason to panic. As people living with diabetes, we should always be extra prepared, especially like current situations of pandemics. Understand your risks. The COVID-19 pandemic can affect any individual. However, studies say those with a history of chronic illness or medical complications like diabetes, high blood pressure are at higher risks for developing the infection. In a diabetic person, along with the body's blood glucose levels, its insulin production is also compromised. That causes lasting complications, especially on the immunity. People with high or unmanaged blood sugar levels have weaker natural defense meant to protect the body against several infections and promote healing. Hence, it usually takes a little longer than usual for people with chronic illness to recover as well. How to manage diabetes during sick days? It's critically important for people with diabetes to understand that COVID-19 illness can raise their blood pressure levels, and high blood pressure levels can lead to dehydration. Stay dehydrated, drink lots of fluids. If you routinely check your blood glucose at home, you'll probably need to do it more often. If you don't test your blood glucose levels at home, be aware of the symptoms of hyperglycemia, which include passing more urine than normal, especially at night, being very thirsty, headaches, tiredness, and lethargy. If you have type 1 diabetes, check your blood glucose at least 4 hours, including during the night. Check your ketones if your blood sugar level is greater than 240 mg more than 2 times in a row. Be aware of symptoms of hypoglycemia. If you are experiencing a low blood glucose below 70 mg, eat 15 grams of simple carbs like glucose, honey, jam and hard candy, juice or regular soda. Eat healthy. Wash your hands and clean your injection, infusion and finger stick sites with soap and water or rubbing alcohol. COVID-19 patients with cardiovascular disease should take in this pandemic. COVID-19 is a pandemic that has affected the entire world, including many positive cases found in India. Due to rapid urbanization and aging population of India, there is an increase in obesity and its associated cardiovascular disease (CVD) risk factors including diabetes and hypertension. Patients with underlying CVD and COVID-19 infection have an adverse prognosis. Pre-existing CVD may contribute to adverse clinic outcomes, and infection may have longer-term implications for overall CV health. Particular attention should be given to CV protection during treatment for COVID-19. Therefore, India remains a large pool of people with diabetes and CVDs who are at high risk of infections. Coronavirus safety tips. Additional reasonable precautions. Take care of your heart. Please do not step or change any of your medications without discussing with your doctors. The International Society of Hypertension ISH strongly recommend that the routine use of ACE inhibitors or ARBs to treat raised blood pressure should continue and should not be influenced by concerns about COVID-19 infection. People with heart disease also need to pay extra attention to symptoms such as breathing difficulty, chest pain, or irregular heartbeat. Although there is not yet a vaccine for coronavirus, people with heart conditions should stay up to date on their vaccinations, such as those for pneumonia and flu. Ask about telehealth remote virtual visits. This will limit possible contacts with others who may have the virus. Remember to eat healthy, exercise, get enough sleep, and manage stress. Ask your doctor about extra monitoring you might need. The internet, WhatsApp, has so much information on coronavirus, but be aware, it's important to remember that not everything you read is the fact. Limit the information you consume about the outbreak and trust reliable sources. How can I prepare in the event I become infected and have diabetes? Everyone should have a plan in case they or a loved one becomes ill. For people living with diabetes, this is very important. Your plan may include gather the contact information for all your doctors, clinic, pharmacy, and your insurance. Write down the names and doses of your medication. Have enough medication for 1 to 2 weeks in case you cannot get to the pharmacy to refill your prescriptions. Ensure you have enough device supplies, pump supplies, pen supplies, monitor supplies, etc. Ensure all your medications have refills available so you do not have to leave the house if you become ill. Have extra supplies like rubbing alcohol and hand sanitizers and soap to wash your hands. Keep simple sugar, glucose tablets, hard candies on hand in case you need to treat low blood glucose, which may occur more frequently with illness. Have ketone strips available if you have type diabetes 1. Review how you manage sick days. General precautions for all. Whether you have diabetes or do not, everyone should be washing hands and water for at least 20 seconds before eating. After using the bathroom and after coming home from being out in public, use hand sanitizer when hand wash isn't available. Face masks are not helpful if you aren't already sick. Limit the information you consume about the outbreak and trust reliable sources. So hope you guys understood the importance of keeping safety while you have diabetes or do not have diabetes. And thank you.